Great. Well, in the interest of time, we're going to go ahead and get started because I have 2 o'clock on my clock, and I know that Doctors Matsuno and Barr have a lot to cover today. So hello, everyone, and welcome to the first of several webinars being offered by the Society of Counseling Psychology as a part of Dr. Mary O'Leary-Wiley's presidential initiative focused on practice engagement. We are excited that hundreds of practitioners have joined us to learn more about providing affirmative therapy with trans and non-binary clients today. I am Dr. Lisa Ferdinand, one of the tri-chairs for the Practice Engagement Initiative and Vice President for Professional Practice. My pronouns are she and her. Please know that you must be present for the entire webinar to get CE credit. I will be sending more information via email about getting CE credit after the webinar. During today's webinar, you can ask questions using the Q&A function in Zoom. Following the webinar, I will be sending a copy of the PowerPoint slides, as well as a handout with resources that Drs. Matsuno and Barr have prepared. Now I would like to introduce our presenters so that we can get started. Dr. M. Matsuno uses they, them pronouns, holds a PhD in counseling psychology, and is currently a postdoctoral fellow at Palo Alto University. They have trained several clinical agencies on trans-affirmative practice and published guidelines on clinical work with non-binary clients. Dr. Sebastian Barr uses he, him pronouns and holds a PhD in counseling psychology. He completed his clinical training at Cambridge Health Alliance under the auspices of Harvard Medical School, including an advanced fellowship in psychotherapy. He has researched, written, and spoken widely about the mental health care needs of trans and gender diverse communities, and is openly trans himself. Welcome, Drs. Matsuno and Barr.
Thank you.
Yeah.
So we'll get started right away. We're going to get started today with a little terminology. I do want to name that we are trying to cover a lot in a short amount of time. So we've paced this pretty quickly. We do so knowing that the presentation and our slides are going to be made available after the fact. So we really encourage you to return to the material, especially if there's anything that you want to spend more time on than we're able to. We'll also have suggested further reading so you can take deeper dives into the areas that we're going to touch on. And feel free to reach out to Dr. Matsuno or me if we don't get to your question at the end or if something comes up for you later. So we offer this slide so that we have some common language, but we were actually hesitant to start with it because terminology is often centered in these kinds of talks when language really is not the end all be all. You can be an affirming and effective therapist without having perfect mastery of the terminology. And you can have perfect mastery of the terminology and not be an affirming therapist because you're missing other components. But language is important. And so, the terms that you use to describe trans and non-binary folks can communicate your familiarity with the community, whether you can be trusted, and whether you learned about gender diversity more recently or in an era when trans folks were more likely to be pathologized. One of the most important pieces to remember is that you need to mirror the language that the client uses when discussing themselves and their communities. So we have listed some terms on the left that are outdated and are inaccurate or considered offensive by most trans and non-binary people. But we offer these as suggestions of things to avoid unless your client uses them, because some trans and non-binary people do use this language. What you'll be hearing most commonly from us today are the terms trans, cis, and non-binary. Very briefly, transgender is an umbrella term meaning anyone whose gender is different from the sex they were assigned at birth. And by sex assigned at birth, we mean that male or female designation placed on a person's birth certificate. People who are transgender have a wide variety of gender identities. There are trans people who are men and women, and there are trans people who are non-binary, meaning they have a gender that doesn't fit the binary system of woman versus man. And there are a lot of ways of experiencing and describing non-binary gender. Some of them are listed on the slide. We use the term cisgender to describe people whose gender identity does match the sex that they were assigned at birth, so people who aren't transgender. And we'll use the shorthand cis, C-I-S, for this throughout the presentation as well. One last thing to underline, you'll also hear us use the term gender affirming medical care. This is how we talk about the medical interventions, including hormones and surgeries that help a person modify their body to live and be seen in alignment with their gender. This is a more accurate and affirming term than sex reassignment. So we also wanted to name at the beginning that the transgender community is incredibly diverse. Today we're limited by time, so we're talking quite broadly about the mental health and therapy needs of trans and non-binary people. But these are, of course, impacted by individuals' intersecting identities and experiences, their sociocultural context, and other biopsychosocial factors. So we're focusing on issues and approaches that are relevant to most trans people, most trans and non-binary people across different intersecting identities, but we encourage your further learning about how factors like racism and class affect trans people's lives and needs. And now I'm going to turn it over to Dr. Matsuno.
Thanks so much, Dr. Barr. So we really wanted to start off talking about the unique experiences and the lived experiences of trans and non-binary people. And it's really, really important to be aware of what these experiences are so that you're comfortable talking about these experiences with your clients in therapy, and also knowing about these experiences in terms of how we conceptualize cases. So we wanted to start off with a little bit of theory. So this is the gender minority stress model. And if you're going to be working with trans and non-binary clients or LGBTQ clients broadly, you need to be very, very familiar with the minority stress model. So what the minority stress model really adds is it adds an explanation for why we see a higher risk for mental health, negative mental health outcomes for trans and non-binary people. It's nothing about being trans, right, that is associated with increased risk. It's about these external sources of stress. So there's two different types of stressors, these external distal stressors like discrimination or rejection. These things can lead to the development of internal sources of stress. So internalizing negative messages about your identity or concealing your identity. So those are called proximal stressors. Both of these relate and help explain mental health outcomes. Finally, super, super important part of the theory is that we also have resilience factors, and these things can lessen the impact of minority stressors and are very, very important to target in terms of therapy interventions. So today I'm just going to go into a little bit deeper about the unique stressors identified specifically for trans and non-binary populations. And so the first one is non-affirmation, which was introduced in 2015 by Testa and colleagues. And this is really such a common experience for trans and non-binary people. It's just not being seen as their true gender, or other people not accepting them as their gender. And so what this can look like is just experiences of misgendering, using the wrong pronouns or name, whether that's intentional or unintentional. Other ways that people make assumptions or use gendered language to refer to folks, and any other microaggressions that, again, show that lack of affirmation for their gender. Now, these different things, they might seem, minor. I know we use the language microaggression, which makes it seem small, and being misgendered one time, like that in itself might not have a very significant impact. But what we know from research is that these things happen to trans people constantly, on a daily basis at times, and that it's really when it's chronic and when it's a cumulative nature of all these different forms of non-affirmation, that's really acts as a form of trauma or an insidious trauma. And we know from the research that non-affirmation predicts PTSD symptoms. So having this trauma kind of lens on these experiences is really, really important. Okay, so next I'm going to talk about invalidation. And so this concept has been identified very recently in the literature as a specific minority stressor. And it goes beyond not affirming somebody's gender to really invalidating, even saying, your gender doesn't exist, right? And this has come up a lot in research with non-binary folks and their experiences. So Invalidation can happen from a structural level, for example, only seeing male and female bathrooms, or that systematic exclusion. And it can also happen in an interpersonal level. And so I like this graphic because I feel like it shows what happens all the time. Is just saying, if somebody comes out and says, hey, like, I'm non-binary, other people just simply saying, like, no, you're not. You're just gay. Oh, you're confused. You're transitioning to being man or woman. And all of that interpersonal invalidation is super, super harmful. And then finally, there's also vicarious forms of invalidation. So being aware or seeing whether or not debates about whether or not your identity exists, and looking at, reading through Facebook comments, like, so harmful. So even if it doesn't happen directly to you, seeing it happen vicariously can have an impact. Okay, so another newly identified minority stressor, which I don't think this has been published, but it's come up in some of the research that I've been doing, is this concept of burdening. And some of this language does come from the experiences of racism, but the concept of burdening means, this expected labor placed onto trans people, whether that's to educate or whether that's to kind of take care of feelings at the expense of the trans or non-binary person. So this could be, being asked inappropriate questions, being asked to educate others non-consensually. This happens all the time in a therapy context when therapists ask their clients to educate them about trans or non-binary issues. And then also, kind of another new term is cis fragility, or sometimes this experience of guilt or defensiveness that comes up when cis folks maybe make a mistake, but then they put the burden of taking care of those feelings onto trans and non-binary people. So something to be aware of. Okay, I know we're speeding through, but we can come back to any questions. So all of these external sources of stress impact internal sources of stress. And one way is internalizing negative messages about yourself. So some really common internalized messages for trans and non-binary folks. One is that something's wrong with me. There has been a history of pathologization of trans and non-binary identities, which continues on through the diagnosis of gender dysphoria. And that's often used as saying, this is mental illness. And so internalizing that message. Another is not feeling like you're trans enough or non-binary enough, and like having an internalized image of what it means to be trans or non-binary. Or other forms of self-invalidation, feeling like the need to meet cis standards in order to be considered a, quote, real man or real woman, something like that. And then finally, feeling like a burden on others, which happens a lot when other people kind of give that message that, this is a real inconvenience to them or burden on them. And I'm going to come back to kind of addressing that internalized stigma later on. Okay, so another proximal stressor is gender dysphoria. A new article by Lindley and Gallupo came out, which conceptualized gender dysphoria also as a proximal stressor. And so when we talk about gender dysphoria, it's really talked about in two different ways, and it's important to distinguish the two. So one is gender dysphoria as a diagnosis, which is in the DSM, which has, very specific criteria. And the other is to describe a feeling. And so sometimes these are differentiated by the uppercase or the lowercase gender dysphoria. So when clients use the language gender dysphoria, they're most likely talking about the feeling and not the diagnosis. And what this feeling of gender dysphoria really is, it's feelings of distress or sometimes, disconnect or dissonance around a feeling of incongruence. And that feeling of incongruence can be related to your gender feeling incongruent with your body or different parts of your body, as well as feeling incongruent with your gender role or feeling incongruent with how you're being perceived in your gender. So it's important to know that dysphoria can be body focused. It can also have a social focus as well. And really important to know that Experiences of gender dysphoria vary from every person. It can be fluid, it can depend on context. Some people's dysphoria will only be triggered in social situations in public, and others might experience dysphoria in private or when they look in a mirror or see images of themselves. And that not all trans or non-binary people experience dysphoria at all, or if they do, there's varying levels of intensity. So really important to know the variety. Okay, so when we think about gender dysphoria, there's also, a really related but distinct is internalizing cis normativity or cis body ideals. And so internalizing that can relate to somebody's dysphoria, but it's also distinct and separate. Or other internalized negative messages about trans bodies can also influence feelings of dysphoria. And we'll come back to those concepts as well. It's important to know in our field, a lot of the way that dysphoria has been conceptualized is through a cis lens of what cis people think trans people feel. So we thought it was really, really important to really highlight the voices of trans folks in describing their own dysphoria. And we wanted to show like some of the variation in how people experience dysphoria. So a 23-year-old white trans woman says, I primarily feel a deep disjunction between who I am and how I'm perceived. Sorry if you hear some dog barks. That's working from home. And so they go on to say, every glance feels like I'm being forced into a box that I do not fit in. I'm intensely aware of every instance that I'm gendered male, and I despise the features on my body that make people see me that way. So you can also see how the social interaction is triggering some of the dysphoria. And then a non-binary participant says, it's a shapeshifter. One day it's a fly, kind of bugs me, but nothing major. The next day it feels like a bear coming down to swallow me whole. So I know I spent a lot of time talking about the unique stressors because I think that's important to acknowledge and be able to talk about in therapy. But it's also so important to recognize trans and non-binary people's resilience and their strengths and what helps them become resilient as well. Unfortunately, like we're not going to be able to go deep dive into this, but I wanted to point you to an article that I wrote a few years ago where I introduced another model called the TRIM or Trans Resilience Intervention Model. So this is the gender minority stress model, but it's expanded so that I've added and really expanded what are the unique resilience factors at a group level and at an individual level. And this comes from research in the literature so far. And then if we identify these factors, then we can also have targets for intervention to increase these resilience factors. And I won't be able to go through all of them, but I just wanted to highlight some of the group resilience factors because I think this often gets overlooked in the individual therapy context. But it's so important to connect trans and non-binary clients to these group resilience factors, groups where they feel affirmed, social support, maybe working from a systems level and working with families on acceptance and affirmation. And then other ways trans people can get involved in activism or having positive representations of their identity. Okay, so I know that was a whirlwind, but we can come back to anything and I'll pass it back to Dr. Barr.
Great. So we are now going to shift into the piece of the webinar where we're really focusing on the practice and the provision of affirmative psychotherapy, applying some of what we've learned and also doing some more. So first I'll talk about some general considerations, and then Dr. Matsuno and I are going to address some specific clinical issues that come up when you work with trans and non-binary clients. So in order to create a foundation for an effective and affirming therapy experience, you must ensure that a client feels a sense of safety and a sense of belonging or inclusion. Trans people face very real threats to physical and emotional safety and are targeted due to anti-trans bias. This is especially true for trans people of color and most notably trans women of color. So when we're practicing in person, it's on the clinician to be familiar with the reality of transnegativity in your local community of racism in your local community, and really consider whether trans people of diverse backgrounds and visibility would be safe coming to your office. Privacy is also incredibly important and is often a foundation of safety and comfort. So one thing you might consider is offering ongoing telehealth as an option for people who don't feel like they can access safety and privacy adequately in person. You also must prevent the perpetration of these minority stressors and insidious traumas that Em discussed earlier. So in addition to avoiding this perpetration yourself, you need to consider everyone a client might interact with in your building, in your clinic, your office space, and ensure that they are also actively working to avoid that perpetration and to minimize the harm that a person is going to experience. So environmental cues of belonging and inclusivity. Your office or your digital space contain a lot of information about you and how you see the world. They also contain information about whether a trans person or a non-binary person is welcome in that space. You want trans and non-binary people to be made to feel normal and affirmed. So things I think you can consider, like, do you have gender diversity represented in the art or the books or the magazines in your space? What do the people on your website look like? Explicit communications are also useful. So, trans flags or statements about affirmation and inclusivity. It's also really important to not name yourself as trans affirming or competent until you've really done the work to ensure that that's true. Again, when we're sharing physical spaces again, really critical is access to safe all gender restrooms. And it's on us as clinicians who know about this to advocate for access to all gender restrooms in the buildings and institutions in which we work. And then finally, the way that we talk about gender also tells a trans or non-binary person whether they are welcome and safe. So language starts with our paperwork. We've got an example here of how you can collect demographics in a way that's inclusive of trans and non-binary people. It's inclusive, meaning that regardless of whether a person is trans, non-binary, cisgender, they are able to fill this out smoothly without feeling othered or like they aren't represented. So in very brief, we recommend that you ask for both name and legal name and explain why you have to ask for legal name. Ask what pronouns the client wants you to use, and use an open write-in for gender. You can normalize the request for pronouns by introducing yourself with the pronouns you use, which was modeled beautifully at the beginning of this webinar. So this can be done in person, but also on your website or your Psychology Today listing or in your email signatures. Importantly, once you have this information, it is of utmost importance that you internalize what the client is telling you about themselves. You need to do the work of seeing them how they're asking to be seen. So you cannot misgender your clients, and that might take some practice and some effort on your part, but that's a critical piece of being affirming and providing that safety to a client. Okay.
Yeah. And that's also important to note on your notes and when you're talking with other colleagues as well.
Yes. So generally, gender neutral language is the most appropriate to be inclusive of your clients who are cis and your clients who are trans and clients who are non-binary. So for future reference, we have some suggestions here for gender neutral language. For future reference, we're not going to go through it all today. As we mentioned earlier, it is really critical that you mirror the language that the client uses for themselves and for their community. So briefly, some other factors in offering an affirmative stance. So Em sort of mentioned this as they were going through these different models, but when shaping your conceptualizations, your interactions, and your intervention approaches, you need to be holding the models of minority stress and resilience interventions in mind. An example of what it might mean to be trauma-informed or minority stress-informed when working with trans and non-binary clients is So a trans client has a high likelihood of either having experienced direct harm from a mental health care provider, knowing a community member who has, or at least being familiar with the modern and historical pieces of the field that have pathologized gender diversity. So clients might understandably then be particularly vigilant in their interactions with you, or seemingly guarded. You might have to really earn their trust before they open up. Framing this as a safety behavior or a trauma response rather than a personality pathology or resistance opens the door to much more fruitful work. I also believe that you cannot truly offer affirming therapy until you're personally really genuinely comfortable with and familiar with gender diversity and really experience diversity as normal and natural. So this involves you evaluating your biases, whether you're trans or cis, because we all live in a trans-negative, cis-normative society. Assess how comfortable you are with gender diversity, how much of the media that you consume features trans and non-binary characters. Is there gender diversity within your own social communities? These are things to be thinking and growing in. And then finally, and I'm going to talk about each of these with their own slides, but balancing our attention and practicing cultural humility. So in qualitative studies about trans and non-binary people's experiences in psychotherapy, participants often talk about therapists either seeming really ignorant or avoidant regarding their transness, or overly focused and zoomed in. We need to pay attention, but not too much. So this means being open to addressing the impact of gender and cissexism, but not assuming that all issues are related to these things. It also means taking cues from the client and noticing how your own discomfort or curiosity and other needs or desires may be pulling you toward or away from gender-related topics. Cultural humility is the practice of recognizing that you cannot be an expert on another person's life. It also means recognizing that our lenses are shaped by our own cultures, and we have to actively work to not misapply those lenses to people with different experiences than our own. So Em talked about the impact of burdening on trans people. For this reason, among many, it's really critical that people outside of the trans community build their knowledge base about trans and non-binary folks. At the same time, here's another balance issue. We must be careful to remain open to those individual unique stories and experiences. Okay.
Right, thank you so much. So now we're going to go into interventions, which I know a lot of people are interested in. And again, we're just scratching the surface, but we're going to provide a handout with additional readings that you can partake in. So I wanted to start off with something that's just really broad that can be used across for any types of interventions. And that's really providing psychoeducation about why, helping clients understand that it's not their fault they're experiencing these stressors or mental health concerns, and really pathologizing the oppression they experience. So this can look like literally explaining the minority stress theory to clients and having them engage with that. That can feel so validating and like, oh, this is why I'm experiencing so much stress, because I'm anticipating, getting misgendered or these other things when I'm in a bathroom, right? So it can just be so validating. And actually the research shows just doing this is really, really effective. And then once you have that language around minority stress, you can help clients identify and label their minority stress experiences. Okay, the second piece is to validate experiences of minority stress and oppression. This seems like very straightforward. We're all taught that we need to validate our clients, but for a lot of folks, this actually doesn't happen. So one dynamic that can happen is, especially among cis providers, is that when they hear a trans client talking about a negative experience, their own biases or feelings of guilt might come up, and kind of feeling like their client is talking about something that maybe you made a mistake on. And so then what that can lead to is saying, oh, well, like maybe that other person didn't mean it that way. Maybe you misinterpreted what they said. Or like, oh, you know, maybe this isn't about your gender. Maybe everybody, it just has a lot of stress when they're in a workplace, right? And those types of statements can be so invalidating. We also think about some of our common CBT interventions is we help clients think of alternative explanations. But if we start to do that around experiences of minority stress, then that can come across as so invalidating and kind of, not emphasizing the impact that the minority stress has. Okay, so I'm going to talk through targeting internalized stigma in therapy. Internalized stigma, I think, works really well to target within an individual therapy context, and we have a lot more research on this compared to some other interventions. So a lot of what I'm going to pull from is from research done by Dr. Israel, and also the RISE interventions, which I can send links to. So first thing to do is assess for internalized stigma. So we need to identify the internalized messages that clients experience. So you might be aware of different signs or ways that a client is showing that their internalized stigma. For example, being uncomfortable with other trans people, or saying, you know, I don't want to associate with this trans person for whatever reason, and then being able to explore where that discomfort comes from, what messages have been internalized. A lot of self-questioning and a lot of negative self-talk can also come up. And then this can also look like, even as far as, self-loathing or self-harm behaviors, or generally just not taking care of yourself. So when you're in therapy, you want to attend to these signs. And when something comes up, maybe a client says, oh, but like, I really don't want to inconvenience them. I know it's really hard for them to use they, them pronouns or something, right? Like you're kind of catching on, oh, maybe you've internalized a message about being a burden on others. And so pausing and helping exploring with the client when that comes up. Or if they're talking about, messages they've heard from other people saying, I wonder, have you ever noticed yourself believing that message? So that's step number one. Step number two is once you've helped clients identify their internalized messages, now we can help externalize these messages. Even asking questions like, well, where did you learn that message? What sources, where did you hear that? Can be so externalizing, saying like, oh yeah, that came from like my church, or that came from my peers. And that's saying this is not something that's an internal truth. A lot of the techniques that we learn from CBT or even ACT is distancing ourselves from our thoughts and recognizing that thoughts are thoughts and they're not truth with a capital T, right? So working on that with our clients as well. Okay, so step three is, this comes from a really strength-based approach, which I love. Exploring with clients how they've already rejected some messages. Maybe they haven't internalized all messages. Like maybe they think, oh yeah, like to be non-binary, I don't have to be super androgynous. Okay, well, how did you learn to reject that message? Oh, well, I met a friend and I saw them being really confident non-binary and they're more femme presenting or whatever, right? Okay, so how could you apply that same strategy to some other messages that you're still struggling with rejecting? So that can be really fruitful. Okay, and now finally, replacing negative self-beliefs. And so a lot of this comes, from CBT interventions as well. If you notice you have automatic thoughts, negative thoughts, what are some alternative thoughts that you can have on hand that you can replace those thoughts with? Having some positive mantras. And then you can do this letter writing intervention, which has been researched. So what this entails is having the client write a letter to a younger person with the same identity, maybe struggling with a similar thing, and writing to them a letter of encouragement. Right? It's so much easier to be validating, to be affirming to other people than it is to be to ourselves. But when we actually write those things down and we're convincing somebody else, we are also convincing ourselves. Because if we say all of these nice things, but we don't believe it about ourselves, that's going to create a lot of cognitive dissonance. And so we're more likely to actually adopt those feelings towards ourselves. So that can be a really useful intervention to do in the therapy room and process with your client. Okay, so then the final step is that we can increase affirmation. So we've been socialized growing up with all these, really gender binary messages, negative messages. But guess what? Like we're still being socialized. We're still taking in messages. It doesn't stop. So how can we re-socialize ourselves, take control over what messages that we are surrounding ourselves with? So identifying what is positive media that I can be exposing myself to. And currently in my Instagram feed, it's like a ton of positive representations of trans and non-binary people. Watching shows and other things like that can be so powerful. And then also identifying who are affirming people or places that you can go to. And through all of this, you want to think about intersectionality. So who's going to be affirming of all of your identities as well. And then similarly, how can you connect to community support, role models? All of these things can really also help fight back against internalized stigma.
Great. Um, so when we talk about gender exploration, oh, and I got a message that some people were having a hard time hearing me, so I'm gonna hold my microphone here, and I hope that this is better. Okay, great. So clients may seek out affirming therapists to help them navigate gender exploration. Or what I commonly hear from folks is that a client came to see them for other reasons and in the process discloses that they're having questions about their gender and they want to use sessions for some more of this questioning and exploring, which is an excellent use of psychotherapy. So if Em will click through, let's talk about how we can best facilitate this process. I want to ground us in 4 truths here. First, gender possibilities are endless, are infinite. We don't want anyone entering an exploration process thinking they have to figure out if they are X gender or not, or limiting themselves to some small number of potential outcomes. So really this is based on the fact that everyone, cis or trans, has a really unique gender when we get really into it. And so there can be no set end goal for this. There's also no one way for navigating gender exploration or development. Second, uncertainty and confusion are okay and normal. This is where we say like it's okay to not know. When I ask cisgender people to describe their gender to me and like really press, there's not a lot of clarity. Like gender for everyone is messy. And so sorting out gender and gender related needs, your internal sense of self in a highly gendered society is going to be tough. When we expect our clients to offer absolute certainty, we're asking for a rigidity that isn't human, and we're really setting them up to fail in this process and not making it an open or safe space. Third, this process contains multitudes. It can be emotional in a lot of different directions. And part of our task as clinicians is tracking our clients' experiences in real time and helping them modulate as necessary. And then fourth, and I'm gonna just triple underline this for us, you don't have the answers and you're not going to. So it's not your job as a therapist, it's not anyone's job to listen to a person and then figure out their gender or figure out what their needs are around it. We can't do that from the external. So our job is to create this affirming and open space and help guide someone through this, but they're the ones that are ultimately going to be able to answer some of these questions for themselves. Okay, next slide. So how does this actually look in the session? Beyond being open and affirming, which is the foundation, I say here, offer models of gender diversity. Our clients are most likely coming from societies and subcultures with cisgender norms and are also just starting to wake up to gender diversity. So some folks might come in with a like super familiar with all of the different gender possibilities and transness, but a lot of times people aren't. They may not yet be aware of all the different ways people can experience and express gender. So it can be helpful sometimes to offer psychoeducation about gender diversity, name that gender is sort of infinite, or recommend reading or television or movies that depict different gender diverse characters, and help them sort of provide models for different opportunities and options. Now, the main processes of gender exploration revolve around identifying the experiences that make a person feel more aligned and what we call euphoric in their gender, and identifying triggers of gender dysphoria. So often this involves experimentation, which can start or take place and continue within the therapy relationship. So clients might want to try on what it feels like to have you use different pronouns for them. I've had clients come in, wearing feminine clothing for the first time with another person, and we process what it feels like for them to have me see them in this way. Um, Along the way, as sources of gender euphoria and that like feeling of alignment and that fit start to crystallize, you all might start talking about different steps that they can take to increase those experiences. Similarly, as you start to have a more solid sense of what triggers gender dysphoria, conversations can shift around how do we minimize those triggers? How do we address that? Um, Supporting someone through this process also involves a lot of normalization and validation. Because of the transnegative messages we all receive and we internalize, people can feel a lot of shame around experimenting with or expressing gender differently. So doing that work that Dr. Matsuno was talking about of listening for internalized stigma, because it's not always going to come out really explicitly. So listening for it and engaging in some of that work around internalized stigma and internalized norms is a necessary component of this often. So we've already begun talking about gender dysphoria and relief from just gender dysphoria a little, and certainly the process of gender exploration shapes ways of reducing gender dysphoria. But we wanted to spend just the rest of our time together talking about this a little bit more explicitly, because as these quotes really highlight, gender dysphoria can be just incredibly paralyzing, and can be a factor at various stages of a person's identity development and or transition, though it is particularly often a clinical issue in the beginning. So our number one goal, our number one tool in relieving gender dysphoria is gender affirmation. Anything that moves a person toward greater alignment or congruence between their gender and their body, or their gender and their social role, or how others are seeing them, is going to increase, or it is going to decrease gender dysphoria because it increases that alignment. So this can be private, or it can be interpersonal, like asking someone to use different pronouns or names. It can be social, like speaking or dressing differently, and it can be physical or medical. And that includes, the hormones or surgical interventions. You may have heard this saying that I have here: gender affirming medical care is is suicide prevention. And I underline it is evidence-based suicide prevention. It's evidence-based mental health care. We have robust and even increasing evidence that trans and non-binary people who seek medical affirmation and have access to it have better mental health than the folks who don't get access. And longitudinal studies like this one that I've highlighted show improvements across different measures of pathology as people get access to gender affirming care. So including things like depression and suicidality. All right, next slide, please. Now, I emphasize this because as people tasked with the mental health of trans and non-binary people, it really should be part of our treatment plan to facilitate access to gender affirming care for clients who are seeking it. I think we're running a little short on time, and so I'm going to go ahead and go on to the next slide. We can come back to this if we need to. But I think that this slide is really important because gender affirmation, including medical steps and or social transition steps, doesn't always completely alleviate gender dysphoria. Or you may work with someone who has gender dysphoria and doesn't have access to the transition steps that they need. Or you may be working with someone for whom medical intervention and social affirmation will eventually alleviate dysphoria, but it's not a particularly fast process and they need help managing that dysphoria now. So there are other strategies that we employ. Gender euphoria is a really powerful tool against the pain of dysphoria. So you can help clients, here we go. You can help clients identify experiences, particularly easily accessible experiences in which they really feel their gender. They feel good in their gender, they feel aligned with themselves, or they feel seen and affirmed, and or they really feel just in love with being trans, proud of being trans or non-binary. These experiences of pride and gender euphoria. So, oh, I've lost my place here. This is the problem with these Zoom meetings. So this is valuable not just in building a and building these into their lives sort of more robustly, but also you can identify like really accessible strategies that then you can have as self-care plans, or what I like to call social care plans. So if someone knows that they're facing a trigger for dysphoria, or they unexpectedly have worsening gender dysphoria, they have these tools, they have these plans that you all have developed that they can go to. So things like putting on makeup and listening to a particular song, or spending time with a friend who genders them correctly. I was talking to a friend who was like, I have a hat. This hat is my gender euphoria hat. Like you can be creative, or you can help them be creative here. It's also really useful to externalize some of the dysphoria as stigma. And this is some of what Dr. Matsuno was talking about too, right? So dysphoria isn't all stigma, but some of it is. And that incongruence that's already sort of there or underlying can be made worse and more distressing by the internalized transnegativity and cis body norms of society. So the work that Em was talking about in terms of affirmation and increasing those affirmation experiences really helps with gender dysphoria. Work that helps them stay exposed to and appreciate gender diversity and trans bodies and trans lives can just be just very lovely and fulfilling here, as well as the work that Em walked us through in addressing that internalized stigma. And I'll highlight connecting with the trans community and practicing love for other trans and non-binary people. It's a lot easier to imagine that love being returned when we are also practicing and giving it, and we are appreciating other trans people. I also think that for some clients, there's an opportunity for growing relationships with their bodies that are not just gender focused. So when gender dysphoria is present, we tend to think of our bodies in antagonistic terms, or really shameful or distanced ways. And helping clients engage in activities where they feel sustained by their bodies, or energized, or can feel bodily sensations that aren't inherently gendered can be very powerful. So things like movement, embodiment practices, some somatic therapy approaches might be really useful for this. Again, all the while being very mindful and tracking how dysphoria, trauma, and internalized stigma might get triggered along the way. And then finally, my last point here is just any work that boosts a person's resilience and well-being and their ability to manage distress will indirectly be useful as well. I think some of these specific interventions are helpful, but also as therapists, we have a lot of tools and skill in this area generally. Okay, next slide. I think yes. So we've come to the end of our whirlwind adventure here. I Dr. Matsuno and I we wanted to leave you with a reminder about trans joy. So there's a great article that came out last week, and I'll actually drop it in the chat, and we'll add it to the handout that we're going to be sending out. But it's in Vice, and it's a round table of trans artists discussing trans joy, so defining it, describing their experiences of it, and I really encourage you to read it as an adjunct to what we've talked about here. I'm from a school of therapy in which part of our role is holding hope for a client's future. So sometimes we have to be the ones to visualize all of these sort of multitude of possibilities and positive futures for a client when their own distress prevents them from being able to do so. So it's really critical in my mind that as therapists who work with trans and non-binary clients, we can really deeply understand and believe in and visualize trans joy. So I think with that, I'll turn it over to M for anything and Q&A.
Thank you. So I think we've had some questions in the chat or in the Q&A. I think one question that we addressed slightly, but I can address further is kind of like, how do you balance burdening with cultural humility with clients, right? So I think it is a balance of maybe a client uses a term that you're not familiar with, but maybe you can, get through the session, but look that up on your own time and continually be doing your own self-education so that you're not putting that burden onto clients. At the same time, it can also be useful to help explore clients, what the client's experience is, or how they define their gender, or how they're using the terms. So I think even acknowledging the both and saying to a client like, oh, like I'm really familiar with what non-binary means, but I'm curious, we've been talking about your identity. I'm curious for you, what does that mean for you, and how did you come to that? So you're using those questions to help your relationship, but also to help the client's exploration. If you notice that you're asking questions for your own benefit because you lack the knowledge or because you're curious, right? Because this is something new, then that can come across as like, wow, you're really just kind of putting this on me. This is you're extracting this information that's not actually benefiting me as the client. So hopefully that just adds a little bit more clarity on how to do it. It's very nuanced and it's kind of balancing the tension between those two things.
And then Sebastian, somebody asked or noted that you mentioned that the term gender dysphoria can be pathologizing, and yet it was used throughout the presentation. And so they're asking if there is an alternative term that might be better to use.
I think I might have said something about, I think I might have said, thrown in like gender dysphoria is still in the DSM and that's pathologizing. I briefly touched on like gender dysphoria being used in two different ways. So one is as a diagnosis and one is to name the feelings of distress that come up. And so every client might have a different relationship with the term gender dysphoria. Some people might not like it because it feels pathologizing. And a lot of people use it, as we use throughout, because it's a helpful way to describe that experience. And a lot of trans people can like understand, oh yeah, I was feeling dysphoric today, right? So I think, yeah, it's used in the two different ways, but used as a diagnosis can often be pathologizing. So hopefully that helps clarify a little bit.
Yeah.
I don't know if you want to add anything, Sebastian.
I think that's helpful. And I think that this is actually where I think open dialogue with a client can be the open dialogue with a client can be important as well. And this is where some of those foundational skills of rapport building and making sure someone feels open and safe, so you can have some explicit communications. I know some people don't feel like the term gender dysphoria fits for them, but what I'm hearing you describe, and your body sounds really difficult, is there language that you use for that, or being open? So I have definitely had a situation where I named something as gender dysphoria for a client and it was very swiftly rejected, and that's not the language that I use. And oh, okay, like I apologize if that's your style, or then listen to how do we want to talk about it, how do we have a shared language. And something that I've seen in the community, which you heard a little from us, is a real renewed emphasis on gender euphoria and a slight reframing of, we're not just trying to reduce gender dysphoria and we're not trying to define trans people's experiences by dysphoria, but in the pursuit of gender euphoria.
Then we have one on, could you briefly discuss the ethical considerations for multiple relationships when the clinician might be an in-group member of the resilience community?
for me, this is an ongoing sort of work in practice and something that I continue to talk about. I have peer supervision. I have a supervisor who I like hire. So I have a lot of ongoing spaces to reflect really critically about my work. And this isn't an issue that comes up again and again. I'm even relocating to a smaller community. And I'm very aware that I'm going to want to participate and grow my own, build my own resilience from the communities that I'm going to want clients to be able to have access to. And so this is, I think, actually something that's helped me is looking at the literature for rural psychology and how people manage multiple relationships in those settings or in other unique identity or cultural groups. And there's a comfort level. Certainly, I have not participated in some things that I would have otherwise because I knew that it was really important that my clients be able to be a part of that. Or I've sought community membership from an area that's maybe a little further away, or I have, an online community that's important to me. But other people choose to be really active and find ways of communicating about that.
Yeah, I think the key is just having that open communication with clients about kind of their experience if they see you in a multiple role and how that might be impacting the therapeutic role. And then if there's things that are coming up that like for example, I was going to a Pride because that's something that but I knew my clients were going to that. So before going there and seeing me, I kind of brought that up with them so that we could plan around that and have that open dialogue.
That's a great point.
Someone else has asked, should we avoid gender dysphoria diagnosis and give another diagnosis instead? And there are a few questions kind of scattered through around, like, how does this help with accessing using insurance or medical intervention?
Yep.
You want to take the first stab?
Sure. Yeah, that's a really good question. I think it comes up a lot is a lot of clinicians do not want to diagnose gender dysphoria because it feels pathologizing. And at the same time, the systems that we have currently often require a diagnosis of gender dysphoria in order to get access to gender affirming medical care. So I think it depends kind of on the situation. But what you can do is have open, transparent communication with clients about the diagnosis. So, let's say that you are needing to write a letter for gender affirming care and you need that diagnosis as a requirement for that access to that care. Okay, so explaining that the process and walking the client through that, having a conversation about the client's reaction to having that diagnosis. Sometimes it can be validating, it might not be an issue, other times it might not. And so then be kind of like going through the pros and cons of like, okay, well, if we use this diagnosis, this is what it can help with. But I think it's really complicated and we didn't get to go super deep into kind of the role in terms of helping access gender affirming care. But I would say that even though it's not the best, I think what is the lesser of two evils, and not preventing somebody from accessing gender affirming care by not giving the diagnosis, I think is a greater harm potentially. That was a really quick way of answering a really complicated question.
Yeah,
but
I agree. And I'll say that I think there are times where gender dysphoria can feel like it can feel like the very right diagnosis. And sometimes
yeah.
there's an alternative situation that can happen that can actually be also bad, which is that someone gets diagnosed with, general anxiety disorder or major depressive disorder, when really the symptoms that are getting sort of flagged or mapped onto that are stemming from this distress around incongruence or oppression related stressors and responses. And so our diagnostic system isn't really perfect. And like Em said, I think having a really explicit conversation with clients about that is very useful and important.
Okay, well, we're at 2:59, so I'm going to suggest that we probably wrap up because I'm not sure we're going to get answer any question too comprehensively. So I just want to take a couple minutes to thank Doctors Matsuno and Barr for sharing their expertise and time with us. I am going to try to tempt them to participate in one of our discussion series so that we might be able to get to some of these questions that we weren't able to, but in the email that I sent, their contact information will be there. They'll also get a copy of all of the questions so we can try and address some of those in the handout in terms of resources as well. So we had close to 800 participants today, which I think really evidences how much practitioners want to know more about how to work well with our trans and non-binary clients. And so hopefully we will be able to offer more webinars on this topic. Thanks again so much, Drs. Matsuno and Barr. We really appreciate all that you shared.
Thank you.
Thank you. And thanks for being an excellent host and facilitator.
Thank you. And again, the email will be coming out that will have CE information, contact information, a PDF of the slides, a handout with resources, and the recording will be available on the Society for Counseling Psychology's YouTube channel in a few weeks. Thank you, everyone.